Hi, I'm Robin Swoboda. Annually, 40 million of us provide unpaid care for a parent, spouse, or other loved one. While family caregiving is a labor of love, it can also be emotionally, physically, and financially challenging. Every day in Ohio, more than 1.4 million people care for a loved one, helping them to live independently at home and in the community. A new law called the Ohio Caregiving Act is helping family caregivers across our state. Well, joining me now is Samantha Brooks, an AARP Ohio Executive Council member and volunteer to explain more about the Ohio Caregiving Act. Thank you for joining us, Samantha.
Thank you for having me, Robin.
What is the Ohio Caregiving Act?
The Ohio Caregiving Act is a law that helps family caregivers when their loved ones go into the hospital and as they transition home. It provides some common sense solutions to make their lives easier. That's why AARP worked with state lawmakers to enact it.
What are those common sense solutions you mentioned?
Well, there are three provisions. The first is identification. The patient now has an opportunity to designate a family caregiver in the medical record when admitted to the hospital. The second is notification. The family caregiver is informed when their loved one is to be discharged home or transitioned to another facility. And the third is training. Hospitals must give family caregivers an explanation and a demonstration of the medical tasks they need to perform when at home.
Samantha, why is it important to support family caregivers in this way with a law like this?
Family caregiving is a labor of love, to be sure, but it can also be overwhelming, stressful, and exhausting. That's why we're fighting for common sense solutions to help, like the Ohio Caregiving Act. It's so important to get this vital information to the public.
Sponsored by AARP Ohio.